For your health now, about 8 in every 1,000 newborn children come into the world with a congenital heart problem. Some are so critical they need attention within the first days or weeks of a baby's life. And here from Children's Hospital of Wisconsin is Dr. Stuart Berger to talk to us about this. And Doctor, very important stuff. We're learning more and more about this all the time. The key to this, as is for many things, is early detection.
Absolutely. Some of these forms of congenital heart disease, it's critical that they get identified as soon as possible. Unfortunately, that's not always possible nowadays with current screening techniques. And the importance of identifying it soon is that you make the diagnosis, you begin the therapy as soon as you can before something bad happens to the particular baby.
What should expectant parents be doing, and what should new parents be doing to keep an eye on these sort of things?
Well, I think number one being keeping a close eye on symptoms. I think one of the things you can ask your doctor now about is neonatal pulse oximetry screening. Most hospitals, but not all in Wisconsin, have the ability to measure the oxygen saturation very non-invasively, and this test would give you the ability to detect some of these abnormalities early before the baby goes home and before something could potentially bad happen to the baby.
Oh, now that's something done before you give birth?
Or
right after?
Right after you give birth. There are ultrasounds that are available, but after the first 24 hours of birth, after birth, you can measure the oximetry, and if it's abnormal, it could be a tip-off that there may be something very serious going on.
You know, I mentioned I have a close friend who went through something of this nature with their little guy, and I know the prospects for him leading a very good life are also very good because they were able to catch it early and they were able to treat it. What are the prospects for people who are treated for these congenital defects?
That is indeed correct. The prospects are excellent for almost all types of serious congenital heart disease. If you pick it up early and you intervene, mostly with cardiac surgery, the babies have excellent prospect for survival with good outcomes.
We're very fortunate to have Children's Hospital of Wisconsin here leading the way in a lot of that work and research. Doctor, thank you for being here today.